Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
I'm very well, Luis. Thank you so much. How are you?
I'm doing great. Thank you for asking. We do have another interesting topic today, which is stem cells and growth factors. This is very interesting because they are related, and I do have a bunch of questions for you here, doctor. Why is it that in the field of regenerative medicine, most of the patients already know about the stem cells, but they don't know, or maybe they don't understand about growth factors? So, can you give us a little bit about that?
Yes. So stem cells, actually, there's also a misconception about stem cells themselves. They think they know what stem cells are, but they don't really understand the concept. So basically, stem cells are cells that renew themselves, divide, regenerate other tissues, regenerate themselves. And in that process, they are releasing growth factors from themselves in order to help with cell proliferation or cell growth, expansion, division of cells. And that's how we get regeneration, is actually a construction of new tissues. And so stem cells themselves release growth factors stimulated by the cytokines and immune complexes that damaged tissue releases. So there's a really intricate play and dynamics that goes on. So growth factors are released by stem cells themselves, and we also combine stem cells from the patient's own body, platelet-derived growth factors, as well as exosomes from other stem cells. And so we have this whole dynamic that goes on with almost 3 different types of stem cells. And that's what stimulates the whole regeneration process.
Can you give us an example of growth factor?
Yes.
Yeah.
So there are many different types of growth factors. We can break it down into 2 umbrellas. So there's exosomes, which are growth factors from the stem cells, from adult mesenchymal stem cells themselves. And then there are platelet-derived growth factors as well. And there are a huge number of types. IGF, which is insulin growth factor, brain-derived neurotropic growth factors. There's so many that I can list off. So these are the main 2 types of growth factors that we utilize.
And since you mentioned the exosomes, does the platelet lysate also are cofactors and also antioxidants in this case?
Yes. So platelet lysate is our version of what used to be, it's actually very widely used right now, is PRP, platelet-rich plasma. We used that a long time ago. Now we have evolved to using platelet lysate, which is a much more refined, very concentrated growth factor concoction from the patient's own body. And in some cases, we may need to use an allogenic or a platelet lysate or growth factors from another source. But in most cases, we use the patient's own platelet lysate, which again is just very concentrated, just the growth factors from the platelets, instead of the platelets that are injected back into the patient and then degranulated or opened or lysed open to release the growth factors. We already have that process done before we inject. So it's very concentrated, very focused, very less inflammatory, less number of treatments required if we're only using growth factor or platelet lysate treatment for a condition. So it's very, very different than PRP in that sense.
And do you combine both stem cells and growth factors in a patient?
Yes, absolutely. So we'll use the stem cells, we'll use growth factors, the two types of growth factors that I mentioned, the platelet derived growth factors, which we call the platelet lysate, and then the exosomes. So we combine everything along with other cofactors as well.
Doctor, what are the conditions that you combine these two? Can you give us an example? Like, do you do it for a knee injury, or I don't know how you use it?
Yes. So, in most of our treatments, unless there's any kind of contraindication, which usually there is not, we will combine the stem cells. Sometimes more than one type of stem cell. Again, depending on the condition, we will combine the exosomes, about 400 million exosomes from adult mesenchymal stem cells. We will combine platelet lysate all in from the patient's own body, all in one cocktail. We will also use other cofactors, certain key nutrients, other key, sometimes a hormone, sometimes, again, certain key nutrients and antioxidants in this cocktail. That makes it so much more effective.
What are the exosomes? What is it?
So exosomes are growth factors as well.
Uh-huh.
Different types of growth factors. Again, the same, almost, we can list off the same types that are coming from the platelet lysate as well. So, but these are just coming from the stem cells themselves that allow for, so growth factors in and of themselves, they allow for increased cell communication. So in the case of exosomes, they help with the cell communication from between the stem cell and the damaged tissue. Um, and then there's the cytokines also play a role in that as well, that allow the cytokines are released from a damaged cell. And so that damaged cell is specific, that cytokine is specific for that damaged cell. So that also signals to the stem cell along with exosomes that, hey, this is where the damage is, this is where we need reconstruction. So all that cell communication is really, really important in the whole regeneration process. So the exosomes play a role there, the stem cells, the cytokines, the stem cells release growth factors themselves. So it gets complicated. So it's about cell communication and the stimulation of regeneration.
So, doctor, how long is this treatment in case a patient wants to come to Guatemala? And can we tell them like ahead of time how long this treatment will last?
So our typical duration of treatment is from 7 to 10 days, and that will cover in terms of the length of healing and everything that we need to do for the treatment is covered in 7 to 10 days. Sometimes we may need longer. Usually is about 7 days, 7 days, 7 to 10 days. And that will allow us to accomplish everything that we need to in terms of the pre-treatment protocol, which I've mentioned in other podcasts, but I'm happy to mention here again, the total detox IV and the total detox program with the nutritional IV, suppositories and B vitamin shots, hormone replacement therapy. In most cases, it's growth hormone, as well as oxygen therapy that we begin, the stem cell enhancement formula, and anything else that we feel necessary. So we have those days to pre-treat, as well as a lot of that continues post-treatment once the patient returns back home as well.
Can we also offer booster injections for these growth factors or any treatments that you do?
Yes, I am very, very keen on doing booster injections with growth factors, either platelet lysate and or exosomes and whatever else I feel is necessary. Very often I will include it as a complementary in 3 to 6 months to ensure that the stem cells are just being nudged along and continue to work and do their job. And I think that it's a really, really nice adjunct to everything else that we do to make the treatment so much more effective.
Can we say that these growth factors, like you mentioned, the PDGF and exosomes, are better than stem cell treatment?
That is a really good question. Do you know, they are, I would have to say that if we're ranking them, stem cells would be gold standard, and then the growth factors would fall below. And the combination of the exosomes and the platelet lysate could be the next best thing. Because we have to remember that not every patient, number one, requires stem cell treatment. We can treat their condition very, very well with just the growth factors, number one. And number two, not all patients are candidates for stem cell treatment. And so in that case, exosomes and platelet lysate would be a great option for them for regenerative treatment. And so that's how we would basically rank it, and in terms of efficacy and the numbers and the potency of a treatment. So that's what we would, and each case is very different. So we assess it on a very case by case basis, and that's how we deduce what is best for the patient.
Based on your last answer, can you tell us who would not be a candidate for stem cells?
I knew that was coming, Louise. Any active cancer, we would not want to do a stem cell treatment because it can potentially stimulate the growth of a tumor or the activation of the cancer. So any active cancer. We have had patients that have been in remission, and we've done stem cell treatment very, very safely, very effectively, and that's not a problem at all. And that's why we do the screening that we do. It's really important that we see blood work, we see markers, we see other things in order to deduce candidacy for stem cell treatment.
I think I'm done with my questions, but I believe you're gonna have a brand new website pretty soon. Can we talk a little bit about that?
Sure. So we're getting ready to launch our brand new, very updated, modern website with so many other features. We'll have links to our podcast. We have brand new testimonials and videos. We have a current event / newsletter, weekly newsletter. We will have other conditions that we will have added that we're treating now, and different modalities that we're using. We're always updating our procedures and our treatment modalities, which is so important in providing the best treatment for our patients. So everything is going to be very updated, and we're very, very excited to have that launch.
Yes, so stay tuned. We are gonna let you know when the new website is gonna be online. But in case you want to contact Dr. Figueredo, you can do it by sending us an email to info@stemcellhealinginstitute.com. Doctor, I always ask you, is there anything else you would like to add to this podcast?
No, I think we've covered a lot of ground today, Louise. Thank you so much.
Okay, it was nice seeing you again.
Thank
you. Take care, doctor.
You too.
Bye-bye. Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.